Here with the latest on the coronavirus is Dr Zoe. Welcome, Zoe. Lovely to see you. Should start off, first of all, with the rise in cases? And actually, on Monday afternoon, England's chief scientific advisor, Sir Patrick Vallance, said the NHS was seeing an additional 1,000 patients a day and described the rise as stable. So that kind of, any stability right now is obviously a huge relief.
I mean, that word, stable, it just gives you a little sigh of relief, doesn't it? And I think it is a sigh of relief. It's early, it's only 3 days. But let's wait and see what the next 3 days show. And if the next 3 days show that there's an additional 1,000 cases each day of hospital admissions, well, then I think when it's 6 days or 7 days in a row, that really is some stability. But what that means is that's still 1,000 people being admitted to hospital every day. It's still huge numbers. But it's not 1,000, then it's 2,000, then it's 3,000. We can kind of predict
but it's
we know where we're going.
15 days from... Because it's 15 days... history.
Yes.
This is what was happening 15 days ago.
Exactly.
And we were all still out. We weren't in lockdown so much, but it was all beginning.
Yeah.
And so when we get to the 15 days of lockdown, then you do get a picture of what everyone's efforts are turning into.
Yeah, so what this is a glimmer of hope, because 15 days ago, as you rightly say, people were starting to work from home, people were starting to reduce their social contact, but completely different to the measures that came in 8 days ago when effectively we locked down. So 8 days ago, if we go forward 15 days, and that's 15 days because on average people get the virus, it's 5 days before they show symptoms, and then on average about 10 days before they would get sick to the point that they need hospital admission. So hopefully what we'll start to see around a week or a little bit more than a week from now is those numbers starting to come down.
Let's hope so.
And this gives us a bit of hope that is likely, we think, to happen.
I think we've got to brace ourselves for bigger numbers because there is going to be a change in the way we count the mortality.
Yes, absolutely. So, so far, the figures that we've seen in terms of mortality are from people who've died in hospital. And, of course, there are people that will have died in the community, in their own homes from this, or in nursing homes or in prisons. And we haven't had those numbers tallied up yet, but we're expecting them to come through.
We're sort of hearing that at least 40 people, the figures that have just been released at the moment, at least 40 people died outside hospital. And so that will bump up those numbers.
So it will bump them up. I don't think it's going to bump them up to the extent that we'll be really shocked. I mean, the numbers already are awful and the numbers will go higher. I think when we think about, as a GP and the patients that we look after in the community, there will be some patients who die at home, and actually for a patient to die at home, usually that means that that patient has been approaching the end of their life anyway, and they've put measures in place to be able to die at home. So although COVID-19 might be mentioned on their death certificate as a possible contributor towards their death, it may or may not be the thing that caused it.
2 weeks ago, 3 weeks ago, a month ago, I don't think, we would imagine ourselves talking so casually about people passing away. And so, we quote these numbers every day now. And so I think, we have to say at this point, if you have lost anyone in your family, a family member or a family friend, our deepest condolences. These are, we know, not just figures, but these are family members.
Absolutely. Deepest condolences to everybody that's been affected by this. And we have now seen people who work within our NHS sadly dying as well. It just brings it home to everybody that nobody's safe.
And yesterday, the Royal College of Physicians said that around 1 in 4 NHS doctors are off sick or in isolation. So I guess never has it been more important for sort of retired professionals to come back in, students, medical students to come in, and also the testing to come through. So some of these people in isolation can come back. Are those testings taking place? Have you been tested yet?
I haven't been tested yet.
Why?
And I guess at the moment I'm not priority because I'm back at work. I'm back in my clinic yesterday and mostly seeing patients, dealing with patients over the phone, seeing a few patients. But the priority here is for people who are self-isolating, who have mild symptoms, or self-isolating because a family member has symptoms. Many of those members of staff actually could go back to work if they have a test and their family have a test and it's negative. And especially nurses and doctors working in intensive care units, those working in A&E and GPs as well, it's really important. And we're starting to see that testing happening.
Right.
The numbers aren't you know, they're not, you know, we're not rejoicing about the numbers, but hopefully they're going to pick up and thousands of members of staff are going to get back to work over the next
something
few days.
in the news today, I just wanted to bounce this around because several studies in recent years have found the BCG jab can be effective against infectious diseases other than tuberculosis. So if you've had the BCG jab, could it protect you in any way?
So there are lots of theories, there are lots of things being tested. The HIV drugs are being tested, anti-malarial drugs are being tested, and the World Health Organization in their briefing yesterday said, we're looking at everything, we're throwing everything at this, but so far we don't have a test that has undergone randomised controlled trials, the gold standard of trials, that can beat this thing. So as of yet, we do not have a confirmed treatment, but there are glimmers of hope from various treatments that people are trying.
Thank you very much.